Hello, I am Peter Okocha. Welcome to Focus on Africa. Our top stories. Stress, confinement and unemployment. We'll be looking at the impact the coronavirus pandemic is having on mental health across the continent.
Because basically I don't like asking people for help. I don't like depending on anybody for anything. I like to do my things myself, my way.
A Congolese family in mourning. A woman has died in London from coronavirus after being spat at work. US officials warn COVID-19 could spread rapidly across Tanzania's largest city, Dar es Salaam. The country's neighbors are also concerned. Also on the program, a medical aid to social distancing. We'll meet the robot that's assisting doctors and nurses in Tunis as they care for coronavirus patients. Thanks for joining us here on Focus on Africa from BBC World News. As countries all over the world scramble to flatten the curve of the coronavirus pandemic, there are fears that an even worse consequence of the outbreak might be looming. Many people have lost their jobs, businesses have been forced into closure, and for many, finding a source of income is now an improbable task. Add to that the emotional distress that comes with isolation, and a mental health crisis could be imminent. The World Health Organization has warned that mental stress could reach unprecedented levels. The BBC's health reporter in Lagos, Charles Mbolu, reports.
Return to life after lockdown as Nigerians in Lagos try to adapt to the new normal. But while efforts are being made to keep the economy afloat, some small business in the service sector have already been forced to lay off workers. Hi, good morning. How are you? Olalekan Akinwumi was one of those who lost his job. He says it has taken a toll on his confidence and self-worth.
It makes me feel useless. It's just like I don't have a life. Like, what am I here for? If I can't pay for basic things, it just can't go on like this. I don't know how people cope when they don't have anything doing or they're just poor. Because basically I don't like asking people for help. I don't like depending on anybody for anything. I like to do my things myself, my way. So now that everything is this way, I keep thinking whatever the future holds, it better happen now.
The United Nations estimates that nearly half of all jobs in Africa could be lost during the course of the pandemic, placing a burden on mental health in the region. In addition to this, nearly 3 billion people around the world are currently confined at home or in quarantine, which the WHO says is raising stress levels with loneliness and depression. In Nigeria, even though restrictions have been lifted, there is still a ban on mass gathering, socialization, and public worship. This is the lobby of one of my favorite cinemas. Thousands of people used to come here every week to enjoy a movie or two together and use this social event as a way to escape the stress of the city. But now, these empty stands show you just how much things have changed. As more and more people lose their jobs, the mental health burden in the region will become higher. But this is not the first time the region has had to deal with a pandemic. One response during that time was to provide food and basic supplies. Jean-Claude Mokanzo worked on the front lines of the deadly Ebola outbreak, but says while the same methods do still work, partner support has been strained.
What is missing at the moment with COVID, which we had during Ebola, are partners who provided things like food kits, which helped keep people calm. But this time with COVID, it's more complicated because there isn't enough financing. All donor countries are having the same issues.
Many African countries may have to shoulder the economic fallout of the virus on their own, but hope ongoing containment efforts will flatten the curve quickly enough to contain the inevitable mental health impact. Charles Mbolu, BBC News, Lagos.
And what about the effect COVID-19 is having on the mental health of young people? The BBC's Lisa Marie Metzjak has been looking into it.
The whole school was called for a brief meeting by our principal, and we were told that we'll be going home the next day. As any normal teenager would be, of course I was excited, but now being home, it's really started to hit how serious it is.
Schools in Kenya have been closed due to COVID-19. Lise Marie is being homeschooled during the pandemic, but her mother is concerned for her mental health during this time.
A part of their life has been stopped. They have smartphones, there are videos that are circulated online. Sometimes she'll tell me that, Mama, you know what, I saw this thing that happened in Italy, people were just dropping dead. There's also, what they share with their friends, and they are thinking now, are they going to go back to school? Are they going to repeat class? Are they going to, extend the year into next year? And I can tell you, in a child's mind, they are really also thinking as much as you do.
How COVID-19 can impact your child's mental health.
And the first one is it can imprint in them the concept of death in a very worrisome and anxious way. The second way that it can affect your child psychologically is this part about social isolation. And so as a parent, what can you do to get ahead of this situation? The first thing I would advise is to be an example yourself. If you're constantly worrying, if you are constantly anxious, my advice to you is be in control, be very conscious of how you're expressing it in your home. The second thing is to limit the exposure that your kids have, especially when it comes to news and updates and stuff like that. The third thing is to exercise with your kids, because remember, prior to the pandemic, the kids were running around with their friends, they were having a good time, but now they're in the house the whole day. They've got to move. And yeah, we'll get over this. Hang in there, be strong for the sake of your child.
Well, for more on this, I'm joined now by Solomon Tefera, who's an associate professor and head of the Department of Psychiatry at Addis Ababa University. Professor, could you paint us a picture of the kind of society we could emerge into after this pandemic?
Thank you very much, Peter. This is an interesting question that has been discussed, especially in the West. But in Africa, we have had conversations around this. And of course, I would expect a few changes to happen. For instance, the hygienic practices that have been advocated and then that have been enforced would likely continue, which will contribute to the reduction of infectious diseases, because, in Africa, infectious diseases are still our number one health problem. So this will have a good impact in terms of preventing infectious diseases. Of course, there would be, a reduction in close social contact. For instance, handshaking would take quite a while to be back. So that would be one change. But in general, I wouldn't expect major changes in social life of Africans.
At the moment, Professor, at the moment, do you think enough attention is being paid to the issue of mental health post the coronavirus pandemic?
I see, the issue of mental health in Africa in two ways. One is existing mental health problems, people with severe mental disorders, which are not really getting enough care, which is a major challenge at the moment. And the other one is potentially, emerging mental health problem as a result of COVID-19 pandemic. So at the moment, we really have very little attention given to mental health. Even those people who have existing mental health problems are not coming to hospitals, and they are not getting enough services. We have seen a significant reduction of cases coming to our hospitals. So this is a major challenge we're facing at the moment.
And if you were in a position to advise countries and governments on the continent, what would you tell them to be doing at the moment?
Of course, we have to be innovative. because people who have mental disorders are especially vulnerable. They can acquire the virus because they may not heed, the safety precautions that are being promoted. So as much as possible, it's good to provide the services close to their home. And also being innovative means using technologies. For instance, in China, they have used the technology, the internet, for instance, for providing mental health services and counseling during the peak of the pandemic. So we can use, in Africa, we have, hundreds of millions of people with cell phones. So we can provide mental health services, especially therapy, counseling, using cell phones. But medications are the mainstay of treatment for many patients with severe mental disorders. So they have to be delivered to patients where they live. And instead of letting them come to the hospitals, which sometimes take a long time, and which exposes them to the risk of COVID-19 infection.
We already know that across many African countries, they struggle with the issue of mental health. Should post-COVID mental health be treated as something separate, or should it be integrated with what most countries already have on the ground?
I think we advocate for integrated services because it's more efficient in terms of utilizing the little resource we have in Africa. So it should be seen together with other health problems. So it should be provided to people close to where they live. That makes it more efficient in terms of using resources.
Professor Solomon Tefera, thank you very much for your insight into this story. We appreciate it.
Thank you very much.
Let's take a quick look now at other stories making the headlines across Africa and the rest of the world. The authorities in Lesotho have confirmed that the kingdom's first case of coronavirus has been detected. It was the last country on the African continent to have been free from the virus. Officials say dozens of people who had arrived from Saudi Arabia via South Africa were tested and one positive case was found. The government of Niger says about 75 fighters from the Islamist militant group Boko Haram have been killed by a regional anti-jihadist force. A statement said the militants died during 2 operations in the Difa region near Lake Chad in neighboring Nigeria. The figures could not be independently verified. Nigeria's President Muhammadu Buhari has appointed the retired diplomat Ibrahim Gambari as his new chief of staff. The former senior UN official also served in Mr. Buhari's military government in the 1980s. He replaces Abba Kyari, who died last month from the coronavirus. And President Trump's former campaign manager, Paul Manafort, has been released from prison after his lawyers argued he was particularly vulnerable to the coronavirus. The 71-year-old will now serve the rest of his sentence for banking and tax fraud under house arrest. Here in the UK, police are investigating the case of a woman who died from COVID-19 after she was spat on by a man who claimed to have the virus. Belly Mujinga, who was Congolese, was a railway ticket officer at Victoria Station in London when she was assaulted in March. Daniel Henry reports.
It's a difficult time to have lost somebody we all loved in a tragedy. Very sad.
To those who knew her, Belly Mujinga was a proud Congolese woman, raising a young family with her husband. She'd spent 20 years building a life in the UK, a life that was taken away from her shortly after being spat at.
Then she started developing what we think it was COVID, and she was very scared about the spit that I had that's causing all this. We all had a bad time when she tell us about what happened to her at work.
Mrs. Mujinga was working at this railway station in central London. Usually she'd be behind the scenes, but on the 22nd of March, Mrs. Mujinga was asked to work on the concourse. On that day, she was approached and spat at by a man claiming he'd contracted the coronavirus. By April 5th, Belly Mujinga was dead.
Mr. Speaker, this House learnt of the tragic death of Belly Mujinga. The fact that she was abused for doing her job is utterly appalling. My thoughts, and I'm sure the thoughts of the whole House, are with her family.
The British Transport Police are investigating. They say inquiries are ongoing and are asking anyone with information to come forward. Belly's former colleagues have set up a fundraising page to help the family as they deal with their grief. So far, more than $20,000 has been raised. Daniel Henry, BBC News.
This is Focus on Africa from BBC World News with me, Peter Okwoche. Still to come on the programme, the mechanical nurse that uses artificial intelligence to provide social distance and a link up with friends and family. Welcome back to Focus on Africa. I am Peter Okwoche. The risk of contracting coronavirus in Tanzania's largest city, Dar es Salaam, is extremely high. That's the warning from the US Embassy in the country. Tanzania has stopped short of implementing strict measures to curb the spread of COVID-19. And as our reporter Sami Awami reports from Dar, the situation has led to anxieties both within the country and along its borders.
Long queues at the Tanzania-Kenya border, Namanga. Hundreds of these lorries have been prevented from leaving the Tanzanian side of the border. Until recently, movements of cargo truck drivers were not restricted in the region, as essential workers who transport critical goods such as food and medication across East African countries. But authorities now fear that the drivers are also transporting the virus. Strict measures rolled out are likely to affect businesses and economies of countries in the region. Already, drivers are feeling the effects.
This whole exercise is taking way too long. We are now running out of money. I've been stuck here since Tuesday last week, and today is when I finally got tested.
Those who have been tested come to mix with those who haven't been tested. Then they are told to go and get their results later on the Kenyan side.
Yesterday, East African heads of state resolved to use digital trackers for cargo lorry drivers to help stop them from spreading the virus. Uganda is also set to use gene expert machines that produce test results in 45 minutes, drastically cutting on the time drivers wait in queues. But lack of stringent testing in Tanzania has made her neighbors nervous, and Zambia closed its borders with Tanzania after a surge in coronavirus cases near the Nakonde border. Many have criticized Tanzania for not taking stricter measures to fight the spread of coronavirus in the country, an allegation that the government denies. Earlier today, the US Embassy issued a health alert warning of an exponential growth of the epidemic in Dar es Salaam and other parts of the country. The statement also claimed that hospitals in Dar es Salaam were overwhelmed. It asked US government personnel and their families to remain at home except for essential activities. Sami Awami, BBC News, Dar es Salaam.
Now, despite calls for a ceasefire during the coronavirus pandemic, Cameroon is still grappling with a separatist war that has killed more than 3,000 people in its English-speaking regions. There are fears that the outbreak in the northwest and southwest could further destabilize the country. Kilian Ngala reports from Yaoundé.
2 years ago, these scenes shocked Cameroonians and were supposed to be a thing of the past, with a ceasefire declared on March the 25th. But evidence seen by the BBC suggests this hasn't happened and that fighting is continuing. Local NGOs and the government are worried that the continuing violence could make it harder to get critical information and assistance to people as they struggle to stave off the spread of the coronavirus.
We have a center that has been made for the COVID-19 patients, an emergency center, temporal center, which we have here, and we've been accommodating patients, suspected cases and confirmed cases. As at now, the government is also building a 24-ward structure for isolation of these patients, which is assumed to take a month to complete. We still want to prepare more to make sure that if it gets to a very critical situation, we may be able to attend to our patients in the right manner.
Health professionals are worried about how the country could cope if the virus spreads.
I must say that before COVID-19 came in, the healthcare system and the healthcare delivery were struggling with a bunch of issues. And therefore, we have a very serious challenge that comes in when we are not prepared. And it makes a bad situation worse. And we now go from five pan, as they say, to fire, adding insult to injury.
Nearly 4 years of fighting has left close to 60% of health facilities in Cameroon's English-speaking regions in ruins, according to UNESCO. They have been either shot, burnt down, or attacked. It is a situation now worsened by government travel restrictions. Humanitarian flights have been grounded. Calls by the United Nations, the U.S. Embassy in Yaoundé, as well as humanitarian organizations on the government to reopen such flights have not yet been heeded to.
We need security to inform, to educate, to sensitize the masses on the coronavirus. Many of them don't even know about it.
Efforts continue to bring about a ceasefire. Until a ceasefire is reached, Cameroon waits with anticipation and fear to see how the virus unfolds. Kilian Gala, BBC News, Yaoundé.
With the worry of the COVID-19 pandemic causing families to be isolated from their loved ones, robots have become indispensable allies in the war against fighting the virus. Outside Tunisia's capital, they've come to the rescue at a local hospital. Nora Fakim reports.
At the Abderrahman Memi Hospital, on the outskirts of Tunis, a new robotic nurse has been welcomed to the team. This mechanical helper has been brought in to give a hand to frontline workers dealing with COVID-19's victims. It can measure temperatures, pulses and oxygen saturation in patients' blood, all without the need for any physical contact between healthcare workers and their patients.
This robot is very important for the medical staff because it will reduce contact with the patients and therefore reduce the risk of infection.
Designed and made in Tunisia by Innova, a Sous startup tech company, this high-tech innovation is a blessing for COVID-19 patients. It allows family and friends, after reserving a time slot online, to see and talk remotely to their loved ones without putting anyone in danger of infection.
The health crisis, since it began, has emphasized the need for technologies such as robotics and artificial intelligence. Today, we have robotics on the front lines, taking on the risks and dangers key workers would normally be exposed to, helping minimize the spread of the virus and saving lives.
For a major public hospital that still has limited internet access, this truly is a real technological leap for all involved. Noor Fakim, BBC News.
Interesting stuff. Now, just before we go, a quick reminder of one of our developing stories here on Focus on Africa. The American Embassy in Tanzania has issued an alert calling on US citizens to take extra care because it says the chances of catching the coronavirus in the commercial capital of Dar es Salaam are extremely high. A statement says many hospitals in the city have been overwhelmed and there is evidence the virus is spreading rapidly in other parts of the country. Officially, Tanzania has recorded just over 500 cases of COVID-19 with 21 deaths. Now, don't forget, you can get in touch with me and some of the team on social media. I'm at Okwoche, but for now, that's it from Focus on Africa and me, Peter Okwoche. Thanks for watching. See you again very soon. Bye.